This is Lindsay Luther. I'm going to be talking to you in this quick presentation about your group presentation that you're going to be doing as part of your class assignments. The group presentation will be done with either 2 students or 3 students per group, and you all should have signed up at this point under the People section of the Canvas course here. Your group presentation is designed to be part of the teaching of this course. What that means is that while we provide lectures or at least some guidance at the beginning of the course, you are also going to be involved in helping your peers to understand key conditions that you'll see a lot in primary care. So you are teaching your classmates about this condition, and you will be the only one teaching your classmates about this condition. So when you're thinking about how you want to approach your group presentation, the first thing I would think about is what you would want to hear if you were a student sitting in the class. I would try to make it engaging, fun. You're welcome to include activities. I want you to think about what would be the most helpful for you to know if you were the student listening to that presentation about this topic. You're going to be the expert on this topic, so you should be prepared to answer questions that your classmates may have about the disorder. I want to show you where you can find all of the information you need to successfully complete the presentation. So there's two places that you can get this information. One is from the Assignments tab. If you click this, you can scroll down to the group presentation. It's at the very bottom, and it's listed as an ungraded assignment because there's no due date on the assignments page, so that you can each submit yours at the appropriate time. The other place that you can find this is in the Syllabus section. I just put a link in there this morning that says Group Presentation Assignment in Rubric. This is just a little bit easier to print out if you wanted to print a copy, so that while you're working on it, and I'll show you what that PDF copy looks like. So we're gonna use this to talk through it because I think this is a little bit more detailed. The rubrics, though, do match. So if you use either rubric, you'll be fine. So a couple of things that you need to do. For your group presentation, you're going to be creating a PowerPoint presentation that is 20 to 30 minutes in length. I've made some suggestions for how many slides you might like to use for each section. However, you can organize it in any way as long as it's logical. You're going to submit one copy of your group presentation to the assignment page at least 24 hours before your presentation. This will allow me to share it with your classmates, and that'll make sure that they can print it and take notes if they need to. So please make sure that you have that in the group. At least one of you submit to the group assignment page at least a day before your presentation. So you're going to have 4 sections of your PowerPoint. These include a background section, a clinical presentation section, diagnosis, and management. In total, your slideshow may be anywhere from, it could be as few as 10 or 11 slides, and it could be up to 35 slides. Whatever you want to do is fine. I would caution you to not write out everything that needs to be known on the PowerPoint slides. If you fill your slides with text, then people will be reading instead of listening to you. So you're going to have 4 sections of your PowerPoint, but you're going to be graded on 5 different categories. So in addition to the 4 sections of the PowerPoint, the last and the largest grade section is professionalism. The goal of this presentation is to get you used to doing clinical presentations, such as you might do at a conference or you might put on as a continuing education activity for your peers once you're out in clinical practice. We want you to get into the habit of working on teams. We want you to get into the habit of delivering professional presentations. So why don't we go down into the rubric and we can look at how this is divided up. So the rubric on the paper copy is just a little bit easier to tease out, which is why I put it on a paper copy and not just in Canvas. So you can see that your background section is worth 15 possible points, 5 points each for the epidemiology, pathophysiology, and prognosis. Your clinical presentation is worth 20 possible points. You get 10 points for your history findings, 10 for your physical exam. Your diagnosis section is 15 points, and you'll get 5 points each for diagnostic criteria, the differential diagnoses and the can't miss diagnoses on the differential list, and the elements of the workup. So what would you do to rule in or rule out this condition? You'll get 20 points for management. So you get 5 points each for using an evidence-based guideline to format your recommendations, for discussing appropriate pharmacological therapy and non-pharmacological therapies, and for talking about what needs to be included in your patient education. You are welcome to provide your peers with a patient education handout if that's something you would like to do, but you are not required to do that. And then finally, your group will get 30 points for professionalism. So while you're delivering the PowerPoint presentation, each member of the group needs to participate in the presentation to the class. So if all of you contribute equally, you get 5 points. You get 5 points for organized and visually appealing PowerPoints. You get 5 points for sounding posed and coherent and looking at your peers, so basically your speaking skills. You get 5 points for sticking within that 20 to 30 minute timeline. You get 5 points if everybody is dressed professionally. And finally, you get 5 points for using basic APA format. Students usually ask about citing pictures and things like that in APA. You do need to use references for your photos if you include photos in the presentation. If you use UpToDate, the UpToDate website has free to download presentations that are already, free to download graphics, tables, and things like that are already cited by UpToDate. And so that's a really good reference that you might want to use and include in your PowerPoint presentations. All right, so that is how we're going to grade you. We will actually grade you on this sheet and give you comments this way. I do want to note that everyone in your group is going to get the same grade. If there is a problem with your group member, one of your group members, or more than one of your group members, we want you to make sure that you start by directly discussing that with your group members. If that does not resolve the problem, you can certainly come to me or to Dr. Oliver and we can help you. But the first question that we're going to ask is, have you addressed this with the group member that you're concerned about? At the end of the day, as I said, most of what you're going to be doing in clinical practice when you're doing things like this is working as a team. And so we want to make sure that you have the skills necessary to work as a team with your peers. So if anyone has any additional questions about the group presentation, about the due dates, or about what their individual assignment topic is, please reach out to me and Dr. Oliver and we can help you with that. Otherwise, you can post general questions about the assignment or about the course to the 24/7 discussion board, as we talked about in class yesterday. Thanks so much.